A rotator cuff tear is a very common cause of pain and disability among young adults. Now, some 2 million people in the U.S. went to their doctors because of a rotator cuff problem. Dr. Alan Saperstein is the chief of orthopedics at Boca Raton Regional Hospital. You're here to tell us more about rotator cuff injuries. Thank you so much for joining us this morning.
It's a pleasure to be here.
I just want to ask you first, rotator cuff tears are a common injury, but who is the most susceptible here?
Well, there are a lot of groups of people who can get rotator cuff tears. One is overhead athletes. People who use their arm overhead for sports like baseball pitchers or tennis players put a lot of wear and tear on the rotator cuff. But also the elderly have degeneration of the rotator cuff tendon over time, and that can cause a lot of pain. And occasionally it can occur from trauma. A fall on the shoulder or dislocation of the shoulder can tear the rotator cuff.
Okay, next question is, what is the difference between the traditional open method of surgery and arthroscopic surgery?
Well, traditionally, rotator cuff repair was performed by dividing the muscles that surround the shoulder. And this resulted in a lot of pain and difficulty regaining range of motion after surgery. Nowadays, we can do it through tiny little poke holes, which we call portals, with a device called the arthroscope. And this allows us to see inside the shoulder and manipulate the tissue and repair the tissue that's torn. And it's a much better way of doing it than the traditional open approach.
Okay, there's arthroscopic surgery. What are the benefits after you get that type of surgery?
Well, the biggest benefit is there's much less pain postoperatively. It used to be that pain after a rotator cuff repair would go on for weeks and would be fairly severe. Now the pain is less and of a shorter duration. Also, it helps you get your range of motion back earlier because there's less scarring that goes on around these big incisions. We now are much more successful in restoring normal range of motion quicker in the shoulder after that surgery.
Speaking of quicker, what is the recovery time for patients who have undergone arthroscopic surgery on their rotator cuff?
The recovery occurs in phases. The first phase is a healing phase and a phase in which you just want to get rid of the pain and swelling, and that goes on for about a week or so. The next phase is restoring motion to the shoulder, and that involves use of devices like pulleys and sticks to try to move the arm without using the actual rotator cuff muscles. And then finally, the last stage is getting the strength back in the shoulder. All told, it takes about 5 or 6 months to get back to full, normal, aggressive sports activity, but it's really the early stages that are the most difficult, and really it's the first few weeks where it's a little bit rough.
Okay, is the arthroscopic surgery, is that an option for all patients or just people with a rotator cuff tear?
Well, most patients with rotator cuff tears can be fixed, and if they can be fixed, for the most part, they can be fixed arthroscopically. There are patients with very large tears where the tissue has retracted and it's just not repairable, but in those cases, it's usually not repairable either open or arthroscopic.
Okay, Dr. Saperstein, thank you for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.